Time to suck down some Java. Apparently, the next time you take a coffee break, you might want to consider a triple espresso. Coffee as medicine? Wow, that's not what my cardiologist has been telling me. Time now for House Call for Health. And Dr. Mark Anderson, he joins us right now. Dr. Anderson, good morning. How are you?
Good morning. Doing well.
I got to tell you, the idea of sucking down a triple espresso because it's good for me is not exactly conventional wisdom. Where's this science coming from?
Well, this is a Japanese study, and what they looked at was the response of small blood vessels to caffeine as measured out in the fingers, which is representative of the small blood vessels that would be going to our heart, too. And they showed that they had a positive response on those when caffeine was ingested, and so they drew the conclusion that if it helps out there, it's going to help the heart function better also.
However, if you have too much caffeine, your pulse, your blood pressure, everything skyrockets, doesn't it? It's bad for you.
That's correct, but I mean, one has to remember that just because it doesn't come labeled from the pharmacy in a vial, these are still drugs, caffeine, alcohol, etc. And anything taken to excess, it could be dangerous, and there's going to be individual responses that are going to vary.
Okay, now, so is caffeine net? Counting in the Japanese study, counting in some of the other studies that say that caffeine might have positive effects in some other areas, net, is coffee good for you or bad for you, or is it a neutral?
I think it probably has some benefit long term when consumed in moderation. So it's kind of giving an effect of exercise with the vasodilatation of the blood vessels, slight increase in heart rate and blood pressure, which are the same type of responses we see when people exercise.
Well, according to the study, the caffeine did not cause the volunteers' hearts to beat more quickly. It simply caused the blood vessels to dilate. And again, that's counterintuitive and not exactly what many of us have been told.
Well, caffeine is a vasodilator and opens up the blood vessels, but it was the specific effect on those small blood vessels where it was having its benefit, and that's what's key for the extrapolating that it could help reduce cardiovascular disease.
Is there anything in coffee itself, other than the caffeine, that might have a positive effect? In other words, is drinking a cup of decaf perhaps the way to go?
Well, they didn't look at that. I mean, they did in this study use decaf comparing it to caffeinated. So the decaffeinated coffee did not show any benefit. And I would have to assume that other caffeinated beverages would have a similar effect as the coffee in this case. Okay,
Dr. Anderson, somebody who does not have high blood pressure, who has not been told by his doc, or it is time to cut back a little bit, how much coffee in a day is too much?
Well, I tell my patients if they can measure it in cups, they're okay. If they're measuring it in pots, they probably need to cut back.
Medical expert Dr. Mark Anderson, part of our continuing House Call for Health series. Coffee is medicine. Well, scientists say it might help the heart, but then again, probably not in the long term. Dr. Anderson, thank you so much for being here.
Thank you.